everyone, my name is Katie, and I'll be talking about Munchausen syndrome. This is also known as factitious disorder or Munchausen by proxy. And you may have heard of this syndrome, and you may have heard of the idea of it. So it's the idea that someone is faking symptoms and illnesses to seek treatment for these symptoms and different illnesses to maybe gain the sympathy and empathy of others, maybe to make others feel bad or to gain some sort of advantage. So it's a mental disease and a mental illness that a lot of people might have heard of. Maybe you might have heard of it. Maybe you've had experience with someone who may have heard of it, but the chances of you being encountering someone with the syndrome itself is very low because there's a lot of dishonesty involved. There's a lot of complications that go into the syndrome itself. And so I'll be breaking it down and I'll be introducing it. So I won't really go into detail, but I'll be introducing it. First of all, a Munchausen syndrome or a Munchausen syndrome is it occurs when someone acts like they have a physical or a mental illness, but they aren't really sick. So it's a mental health disorder where you basically falsify or you exaggerate, or maybe you even induce a lot of physical and emotional and cognitive disorders. And some people act this way because it's suggested that they might have had a bad childhood or a very traumatic childhood. So they feel the need to be seen as being sick or being ill or being injured. It's not necessarily for them to achieve a concrete benefit. It's not about getting medications or getting financial aid because them getting treatment and them suffering from all these illnesses creates a feeling of sympathy from other people, and that's exactly what they want. And so when someone has Munchausen syndrome, they are believed, or they themselves believe that they have a lot of illnesses and that they're suffering from a lot of serious, and severe issues when really they aren't that sick. The cause of Munchausen syndrome remains unknown, but researchers are looking at the role of biological and psychological factors in the development of this syndrome. So, according to some of their theories, there's a lot of theories regarding the brain. So, there might be brain dysfunction. A lot of it has to do with maybe a history of abuse or neglect as a child. Usually, a mother will impose this syndrome onto their children. So usually the mother will suffer from it, but they'll make it look as though their children are suffering from many diseases. And so with that, they'll gain a lot of sympathy from others. That's a case study that I'll be covering later in this workshop as well. Another possible cause is when the patient has a history of constant illnesses that require hospitalization. And so when you've had such a background with being exposed to having illnesses, and maybe you were used to the feeling of having someone feel the sympathy for you, you then induce all of these symptoms on yourself to feel the sympathy again. Researchers are also studying a possible link to maybe personality disorders or common. So these personality disorders that are common in people with Munchausen syndrome. The symptoms of the syndrome are very complicated because they change from person to person. Munchausen syndrome is named after a guy called Baron von Munchausen. So he was an 18th century German officer. He was actually known for embellishing the stories of his life and his experiences. Most of the symptoms found in people of this disorder are related to physical illnesses. So you might have chest pain, you might have stomach problems, fever. It's not so much about a mental disorder, because it's more about having physical symptoms. So you can lie about your symptoms, you can fake your symptoms, you can even harm yourself to inflict symptoms just to prove to your healthcare professional that you have these symptoms. You can also alter test results just to show that you are sick and you are dealing with an illness, and so please treat. Some of the warning signs of Munchausen syndrome can include dramatic but inconsistent medical history. So, this is if you come in with your child at 2 years old and she has a rare blood condition, or maybe she had asthma, or so many different medical issues, maybe more so on the physical side and more on the medical side, more so on the mental side. But the issues that are presented are very dramatic, they're very serious, they're very severe, but they're very inconsistent. So they may be present at one time, but they may be completely off the next time. And so that creates this feeling of inconsistency. And so that's where doctors will maybe see that you're not very consistent with your medical history. An illness that you have doesn't just go away, it's there. You can also have unclear and uncontrollable symptoms that change or become worse after treatment has begun. This is very common in people as well when they have Munchausen syndrome. So, if their stomach hurts and there's a treatment for it, sometimes their stomach will hurt even worse, or sometimes they'll introduce more symptoms, or their symptoms will be even worse after the treatment for this stomach has already begun. Let's say they also know a lot of terminology about hospitals and the medical treatment, or just medical terminology itself for this illness. They know this because they've looked into it and because they want they know a lot about the illness that they want to believe that they have, and they want others to believe that they have. And so normally, when you have an illness, you wouldn't really know what it is, except they would already know what it is and they know it very well. And they'll be able to explain it to you in a way that makes you rather confused about how they know it so well. You could also have a presence of surgical scars, an appearance of new or additional symptoms after test results, as I've covered before. Symptoms only appear when being seen with others or being observed. This is a big one because some people, they'll, let's say, they'll be in a wheelchair because they their thighs were amputated, and so they're experiencing paralysis and they can't walk. But let's say alone, they're completely fine. When they go out in public or when they're seeing their friends, they need a wheelchair because they've been dealing with this illness for so long that now, they need to inflict a feeling of sympathy from others. This is also when they're very willing and eager to take medical tests just to prove that they are in fact sick and they are in fact dealing with this medical illness. So, because Munchausen syndrome has a lot of complications with it, so as you know, when you're faking all these illnesses, and it might start from when you're very young, it can be hard because there's a lot of dishonesty involved. When you go to the doctor and the doctor sees that you have no physical reason for your symptom, or if the physical symptom that someone is suggesting to you um, it implies that they might have inflicted it on themselves, such as self-harm, then they'll be sent to a psychologist. And psychologists actually use specifically designed interview and assessment tools to evaluate the person for Munchausen syndrome. And then the doctor will depend on their diagnosis without actual physical or mental illness and their observation of of the patient's attitude and behavior. So if they don't really show the symptom, or if it looks as though they've harmed themselves to show that they have that symptoms, then they'll be sent to a psychologist. Usually, it's actually recommended for many psychologists to work together to really understand the situation. And because they have different tools to evaluate the patient, it makes it easier when two people work together. As for prevention, it's once again because it's very hard to treat Munchausen syndrome, it's also very hard to prevent it because a lot of people the syndrome itself is predicted to have emerged from negative experiences as a child. So if you suffer from child abuse or from depression and anxiety, you may have a higher chance of getting Munchausen syndrome. And so to prevent it, some people suggest preventing and really detecting it early detection of child abuse, and education for parents about depression and anxiety can help, because not only can it be the child that will suffer from Munchausen syndrome, so the child themselves can possibly think that they have severe medical issues, but the parent themselves, if they suffer from child abuse as a child themselves, they could potentially inflict these symptoms onto their child. And so the parents might be okay, but they might inflict symptoms on their child and cause other people to believe my child is ill. My child has a medical illness, and so I need to seek treatment for my child. Now, treatment as itself. If you have Munchausen syndrome, you wouldn't really seek treatment for Munchausen syndrome because you're hiding the fact that you have Munchausen syndrome. You're hiding the fact that you're faking symptoms and you're doing it so that others can believe that you have this. So if you have this syndrome, you'll actively seek treatment for a lot of different disorders, and you're also going to be unwilling to admit and to seek treatment for the syndrome itself. So a person with Munchausen syndrome will not likely go to a healthcare facility and seek treatment for Munchausen syndrome. So then, because of this loop that goes on and on and on and on, it can make it very, very hard to treat it and to also recover from the treatment. If the caretakers can protect you from self-harming and they can educate you more about the consequences that can occur from you being involved with faking symptoms, then it may be helpful. But again, if two physicians are working together, let's say you have a psychiatrist and an internist, it is also suggested. So therefore, in treating a patient, the first goal is to modify the patient's behavior. If you work out psychological issues that may cause the person's behavior, you might be able to understand where it's coming from. So then, because there are no medicines itself to treat Munchausen syndrome, you can't physically take a medicine. The secondary treatment, which is considered a primary treatment considering there are no medicines, is psychotherapy, which is a type of counseling. Counseling, psychotherapy, it focuses on changing the thinking and the behavior of the patient. And it's also recommended that you go to family therapy and group therapy to really learn more about yourselves and to assure yourselves that you are fine and you are well. So as I've mentioned, because there are no medicines to treat Munchausen syndrome itself, it's very difficult to identify and to treat this. It also makes it difficult to recover from the syndrome. However, there are medicines that can be used to treat some disorders related to Munchausen syndrome, such as depression and anxiety and personality disorders. However, these medicines must be very carefully monitored because of the risk of using it harmfully or the fact that they never might have been picked up from the pharmacy. Excuse me. Now, as for whether or not it's common, there are no reliable statistics as of now regarding the number of people in the US who suffer from Munchausen syndrome, although it's considered to be rare. It's estimated that 1% of the hospital population will meet the criteria. And so, because of that, it's very hard to obtain accurate statistics on the syndrome due to dishonesty in representation. And people with Munchausen syndrome, they tend to seek treatment at many, many healthcare facilities, not just one. And not only that, they may seek treatment at one facility because of one illness that they might have inflicted, but they could also seek treatment for another illness that they may have at another facility. And so, because of that, it may stack up and overlapping with each other. So it's very hard to obtain accurate statistics that will actually allow us to understand the severity and how common this syndrome is. And an interesting fact is that while this syndrome usually is seen in children, most of the time it affects young adults. And we don't really know this, which is the surprising part is that young adults suffer from it more than children do, including men. It's more common in men than it is in women. So, some of the complications of this disorder is that the patient is at risk of severe health problems because of the self-harm that they caused upon themselves. And because of that, there's also a high risk of suffering with depression and anxiety and personality disorders. Because you're also seeking treatment for a lot of different illnesses, you might be taking a lot of medicines and narcotics prescribed from your doctor. Let's say you do a really good job at convincing. So because of that, you could have a high risk of suffering from reactions due to so many medicines. You could suffer from a lot of health medicines related to taking medicines that aren't meant for people who don't have the illness. If you don't have the illness and you take the medicine, it could potentially affect your body negatively. And the procedures that are performed on you could be dangerous, and you could be at a very high risk of substance abuse and also suicide attempts, and so it can be fatal. The heredity of Munchausen syndrome, it is not hereditary, it's not genetic, and so it's not passed on from the family. It's more so about their background and how they grew up as a child, because it's mostly based on being abused as a child and maybe having a history of a lot of illnesses that require hospitalization. Some of the interesting facts about Munchausen syndrome. The victim is not always a child, as I've mentioned. It can be young adults. In fact, most of the time it is young adults. Munchausen syndrome can be fatal for a child. This is especially the case if a guardian, so normally a mother, will inflict these symptoms on the child and cause them to believe that they have a lot of illnesses. And so, because of that, they'll seek treatment for all these different illnesses. If they clash against each other, they could potentially cause the death of the child because they're taking medicines that they aren't supposed to be taking. But because it may appear severe or serious, they might feel like they need to take it, or the doctor might need to prescribe it to them. So then, following up from that, the abuser is usually the mother. Munchausen syndrome can take years to discover because it's very hidden all the way at the bottom. And a person with Munchausen syndrome can be masked as someone who has a different illness. That's what makes it so difficult and complicated. And it's very hard to identify, treat, diagnose, prevent, and in general, it's pretty dangerous. Finally, a lot of scientists recommend that close surveillance is the key. So I have a case study here. Jordan is a victim of Munchausen syndrome caused by her mother at a young age. And when she was young, when she was a child, she was convinced to believe that she had severe asthma and two rare blood diseases, a lot of serious back problems. She also was convinced that she had multiple broken bones, and because of all of these illnesses that her mother inflicted on her, she took a lot of medicines and narcotics, and it was not healthy, and it caused a lot of health problems for her body. So I'll present a short video from her opinion.
our next guest, Munchausen by proxy. This wasn't a disturbing story she watched on TV. She claims this was her life.
I spent my entire life believing that I was sick and that my body was broken, only to find out that I was never sick at all. I believe that I was a victim of Munchausen's by proxy and that my mother was the perpetrator. It wasn't until I was in a college class and we were talking about Munchausen's by proxy that it hit me that, oh my gosh, this was my life. I felt so overwhelmed and scared. I thought that I had severe asthma, that I had 2 rare blood diseases, severe back problems. I thought I had multiple broken bones and was constantly in casts and braces for those. I took a lot of medications, narcotics a lot for different reasons. I think that the sick role became my identity. When I thought that I was possibly a victim to Munchausen's by proxy, I got my records from as many hospitals as I could. I came across one record that really caught my eye that said possible Munchausen's by proxy. I was just absolutely blown away. I came across one from when I was 2 years old in which I tested positive for drug overdose with acetaminophen. My mom would report that I was vomiting. There was records that stated that I was self-inducing vomiting. I came across a record that stated that my mom was telling the doctor that I had really bad stomach pains, and then she intensely looked at me and told me to show the doctors where it hurt, and I half-heartedly pointed at my stomach. At one point, my mom really wanted me to take IV Rocephin. When she had believed that I had been given it, she claimed that it worked, but she wasn't aware that I had really been given a saline placebo. When I was growing up, I was really close with my mom. It was me and her against the world. I was in pageant when I was 4 years old. I ended up getting runners up, and my mom got Best Mom Award. I get angry and kind of disturbed when I think back to the fact that my mom won Best Mom Award because little did anybody know she was making her daughter sick. I feel in a lot of ways like I didn't get to have a childhood at all.
Please welcome our next guest.
So these are the references that I used. I just want to talk about the case study for a while. Because Jordan because she experienced this as a child, she now believes that she no longer had a childhood. And so Munchausen syndrome often occurs because of a history of child abuse, or maybe they were neglected as a child. And so in this case, it proves once again that the mother is usually the abuser, and so her mother was abusing her, and ever since she was 2, she had a history of illnesses that required hospitalization, and that there were a lot of severe illnesses that were associated to her when she was in fact completely fine. And although this is just one case, there are a lot of people in the world who are also continuing to struggle with Munchausen syndrome. They might be inflicting it on their children, they might be inflicting it on themselves. And so it's significant and crucial that we one day find a treatment to this syndrome. And with that, I'd like to thank you for joining my workshop and watching my workshop. And I hope that this was a knowledgeable introduction for you about Munchausen syndrome. Have a good day.